We've been getting very, very different reports. I mean, at first, China said everything was fine, no human-to-human transmission, no health workers, a mild disease, and then cases kept cropping up everywhere. And the latest, of course, is that there's now concern that there may be sustained human-to-human transmission.
You talk about it being a comedy of errors. Although
Yeah,
you're
well, I
saying the
mean,
lesson of SARS has been learned, perhaps it wasn't
I
learned
think that
quickly enough.
China did learn a lesson with SARS. By hiding SARS, the economy suffered much more than it would have if there were rapid action. I think that China simply hasn't demonstrated the transparency, the cooperation, and also may not have the public health capacity, because if it was true that they caught this in Wuhan right away, then we would have expected the outbreak to have been under control, clear contact investigations, and you wouldn't expect people to be getting on a plane unknown to the Chinese authorities.
Well, that's the response from the Chinese authorities. What do you make of the response out of the World Health Organization so far?
The World Health Organization decided to call an emergency meeting tomorrow to decide whether this is a global health emergency. But WHO was really relying on Chinese information, and previous situation reports that it put out were, I think, too reassuring. And we now have so many, huge unanswered questions. Can this be transmitted easily between humans? What was the exact animal that was responsible for transmitting it to a human in Wuhan? Is China actually doing thorough contact investigations? There are many vital questions that are still unanswered that I hope we'll get to the bottom of with the World Health Organization.
And just circling back to where we began, I guess also a question yet to be answered is how responsive China will be to outside offers of help.
Yes, I mean, this is always a big problem. And all I can do is hope that it's learned a very, very hard lesson from SARS, that when you don't ask for help, when you don't cooperate, when you're not transparent, things can get out of control very quickly. We have to take this very seriously, and if China doesn't, I think the international community and the World Health Organization is going to have to take some kind of control.